Bon après-midi tout le monde. On attend, je crois, toujours la ministre de la Santé, Patty Hajdu, mais je suis ici, qui va nous joindre sous peu. Je suis ici avec en ligne la ministre Bennett, ministre des Affaires couronnes autochtones. Je tiens brièvement à faire le point sur la rencontre de ce matin et de cet après-midi concernant le racisme systémique et le racisme dans les soins de santé au Canada. Évidemment, aujourd'hui, on a pu rassembler, la plupart d'entre eux étaient des professionnels dans la santé autochtone qui vivent le racisme systémique à tous les jours. Présence d'à peu près 400 personnes, au-delà de 400 personnes à plusieurs points de la journée. D'entrer un témoignage encore émotionnel d'une famille, encore sous le choc du deuil. Et ensuite, témoignage de professionnels, médecins, infirmiers, infirmières qui travaillent à chaque jour dans le domaine de la santé au Canada. Et donc, l'idée d'aujourd'hui, c'était d'entendre les témoignages de ces gens. Ce qui a un peu frappé, c'est que l'expérience qui a été relatée, par exemple, par la docteure Marilyn Cook, qui a fait ses études dans les années 80, est à peu près la même expérience que ceux qui étudient en médecine aujourd'hui, 40 ans après. Des choses qui se répètent sans issue. Donc, l'emphase aujourd'hui était, à vrai dire, sur la responsabilité des ordres de déontologie des ordres médicaux, leur devoir même de travailler et de combattre le racisme systémique. Là, l'heure n'était pas aux politiciens de s'exprimer. On a tous eu l'occasion. Mme Hajdu a parlé pour le gouvernement fédéral, mais l'idée aujourd'hui, c'était de réfléchir évidemment sur ce qui a déjà été témoigné dans toutes les commissions, les rapports de commission, mais aussi de l'expérience qui existe aujourd'hui. Ce qu'on peut tirer de cela, c'est qu'il y a beaucoup de travail à faire, évidemment, en phase sur la réforme, les comptes que doivent rendre les ordres professionnels, la formation, en phase sur la formation, responsabilité, oui, provinciale, oui, fédérale. Mais ce que tout le monde a retenu, c'est qu'il y a du travail à faire. Le racisme systémique ne va pas être éliminé du jour au lendemain, mais ce n'est pas une excuse d'agir maintenant. Et donc, ce qu'on sait de tout ça, c'est qu'en soutenant ce qu'on peut parler en termes généraux du principe de Joyce, c'est qu'on sait que Joyce est morte. Elle devrait être en vie aujourd'hui. Mais elle n'est pas morte pour rien. Et donc, le devoir de tout politicien, de toute personne au Canada, c'est de s'assurer que sa mort signifie quelque chose et qu'on fasse quelque chose. And I'll summarize briefly in English. I wasn't supposed to speak this long, but today was an opportunity to listen to those who have lived experience in the medical industry professions, and we heard a powerful testimony from Carol Dubé, still as a single man, now raising a family of 7, still mourning, that he wants us to continue, the federal government, provincial governments, all Canadians to continue to fight racism in all its forms. He wants justice for Joyce. He wants us to espouse Joyce's principle, which is still a principle which is being consulted with his own community for their support. To eradicate systemic racism and to ensure that Indigenous peoples have first-class health care. This was an opportunity today for the medical professionals to speak about their lived experiences. I think what shocked all of us and doesn't surprise Indigenous peoples is that really and we're talking here about the most well-educated, most intelligent group of people are still being subject to systemic racism. And the testimony of Dr. Marilyn Cook of her medical experience and training in the 80s is no different than Dr. Kay Doname, who's now at the Cleveland Clinic, a brilliant Inuk doctor. And those are the medical students, and it still goes on. So a lot of the focus today was on the medical professions, and rightly so. But I think the reminder also is that the responsibility lies with us, the federal government, as well as with provincial and territorial entities who have direct jurisdiction over a large part of the healthcare services in Canada. So, sur ce, je passe la parole à la Miss Bennett, Dr. Bennett, et ensuite à la Miss Hajdu. Merci.
I think Minister Hajdu, you should go next.
All right. Can people see and hear me now? Okay, great. Thank you. Well, thank you very much. Listen, as Minister Miller has said, it's always a very powerful experience to be trusted to hear these very personal experiences, and there's so much to reflect on. I have a deep gratitude to all speakers who shared fearlessly about their personal experiences of racism in the healthcare system and in the healthcare education process. And despite many barriers, as Minister Miller said, Canada is so fortunate to have these excellent leaders across our country who are tirelessly acting for change. Early in my career, I interviewed people about substance use issues in my community, and the healthcare system came up repeatedly as a place where Indigenous people faced extreme personal violence. And then I ran a homeless shelter where I saw extreme unkindness by systems and people that were paid to deliver it to anyone who needed it. So all of the stories of racism in schools, as students, as advocates, as patients, as families, sadly is not shocking to me. And I want to remind people that the racism is not an accident, that the system is not broken, it's created this way, and that the systems and the people in them are incented to stay the same. Because systems are built and maintained by people. And so the hopeful part of me is that they can be changed. But it does require effort that's intentional, and the change has to be safeguarded and maintained. Many speakers reflected on the reality that healthcare in Canada is a shared responsibility, something I, as Minister of Health, federally know very well. But we can't let that be the excuse to resist change. It is time for all of us, regardless of our jurisdiction, to step up and use the power that each of us has to insist that systemic violence of Indigenous peoples end. I'm grateful for the political representation of the provinces that were able to make it today, and I look forward to working with all provinces and territories when we reconvene in January. We are asking that provinces and territories, healthcare providers, medical schools, and all of our Indigenous partners come to a follow-up session in January with concrete plans for training, prevention, healthcare data, wraparound services, and accountability. And my colleagues and I are committed to moving forward on distinction-based healthcare legislation and to shifting health service ownership to Indigenous communities. But as I mentioned, we understand that these issues are far-reaching, and they require all partners to move forward together to ensure that health services in Canada are delivered in a way that doesn't perpetuate systemic racism. Joyce Echaquan recorded something that many Indigenous people are experiencing right now at this moment all across the country. It was not an isolated incident. It is not a few bad apples. It is a system that not just turns a blind eye, but implicitly endorses and reinforces this behavior many times over. And Joyce, in the middle of her deep pain, showed something that so many people would prefer to ignore. So she gave Canada a gift that has to be honored, no matter how difficult it is to receive it. And to her family, I want you to know that your beloved partner and your mother was courageous and was determined to leave a better country for you. So we, as leaders, cannot let her gift of bravery go to waste. Thank you, Miigwech.
Hello. Hi, it's Carolyn Bennett, and I'm here in Toronto on the traditional territory of the Mississaugas, the Credit, and I think I just want to be very brief that it as upsetting as this meeting was, it was so important, and as the Métis elders said, we sort of we've broken through, that we're starting to talk about this in a way that hopefully will honor the legacy of Joyce Echaquan and the wishes of the family, that this that whether it's Joyce's principle will carry on such that other families don't have to go through this. So I was inspired, as always, by the physicians and nurses and midwives and the people who came together today to tell their stories. But as Minister Miller said, that Dr. Marlene Cook's experience of medical school, unfortunately, is the same as his daughter's right now, and we have not moved forward. And that from the TRC and from Brian Sinclair's death and from all of the reports, and using words like cultural safety, we are maybe. Uh, Rosemary Brown used to say that euphemisms kill. And I think that what today was clear is that this is outright discrimination, and it is anti-Indigenous racism, and that it's got to stop. And so, well, I think we were very honored to hear all of those inspiring professionals, but I think we were also pleased to see that from Accreditations Canada, the Canadian Nurses Association, the Canadian Medical Association, Indigenous Physicians Association, Indigenous Nurses, that all of them were involved in the chat and committing to come forward with a concrete plan to stop this and to achieve justice for Joyce.
Thank you. We'll now take questions from journalists. We'll start with one question from the phone. Operator, I'll leave it to you. And then if the other journalists in the room want to line up at the mics, we'll take your questions after. Thank you.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question, the first question, Kirsty Kirkup, Global and Maid. Please go ahead.
Hi, good afternoon. Thanks for taking our questions. I previously asked, and I know this came up in the discussion today, about what should be done around federal health transfers. There's also some calls being made around the Canada Health Act, stipulating in the Canada Health Act expectations around standards for care for Indigenous patients. Has there been any thought given to specifically looking at the language contained within the Canada Health Act as part of the specific federal response to pervasive systemic racism in health?
Thank you, Kirsty. And I remember that question from a couple days ago. I think from my perspective, we're open to looking at all tools that will be identified by our partners, in particular our Indigenous partners, as useful in provoking the kind of systemic change that has to happen. And, they're not, when we think about health transfers, often, they're thought of in a punitive fashion. But I think we also have to have the promotion of systemic change as well as the punishment of bad behavior, if you will, because I think, having only just a year under my belt as the Minister of Health, I can tell you that I'm not certain necessarily that punishment is the greatest way to get to these kinds of outcomes. And so I'm looking forward to hearing from Indigenous partners across the country, as well as the provincial partners, the regulatory bodies, the medical health professionals that are working in the field, the various leaders at the various colleges to identify how we actually incent cultural change, because I'm less interested in punishment than I am in systemic change. And systemic change takes more than fear. It actually has to rely on a willingness, a deep willingness of participants to share power. And ultimately, that's the conversation that is the hardest one to have in my perspective.
And just as a follow-up, if I may, it was 3 years ago that allegations of coerced sterilization were first being raised. I was writing about it 3 years ago. There was subsequently a House of Commons committee study that contained recommendations. There's been talk of convening federal, provincial, territorial roundtables on coerced sterilization. And I know today it was pointed, that specific practice was pointed to as an example of systemic racism that continues to exist within the healthcare system. So as someone who's been reporting on some of these allegations for a long time, I'm just wondering what today changed, compared to 3 years ago. How has the status quo been addressed in any way?
It was a very powerful reminder by the speaker today, the senator today, about all of that work that has preceded me as the Minister of Health and the need to take action. And I know Minister Bennett has worked on this file as well, so perhaps I can turn to her because she has more of a history in terms of her direct involvement with the issue. But I can tell you that my intention as Minister of Health is to do everything within my power during the time that I am Minister of Health to address systemic racism and oppressive behavior. And so I'm looking forward to working with partners at all levels to take these issues seriously and to have tangible steps to actually address them in whatever system they exist. So I'll turn to Minister Bennett to give a bit more history on that.
Well, I would just like to say, Christy, that again, to have the colleges of physicians and all of the regulatory bodies involved in this conversation, and therefore in the coerced sterilization conversation is going to be really important. That people should lose their license for that. You can't do that, and asking people while they're in labor if they'd like to have their tubes tied is not acceptable. And so I think that, or because somebody's already had 4 children, and so I think that again, that this meeting lifts up the roles that all of us play and the levers that we have to be able to move forward. I think that as Minister Miller is looking to co-develop distinctions-based health legislation, that the issues around prevention, cultural safety, traditional healers. I think there's a lot of things that we can do, but frankly, the regulatory bodies have to do their job, and we have to make it easier and for Indigenous people to be able to complain and then to be heard when they complain. And we heard today that still that's not happening.
Thanks, Christy. Olivia, would you like to go next?
Good afternoon. Thanks for your time, ministers. I'm wondering what you hope these meetings actually accomplish at the end of all of this, and what can actually be done at the federal level, and what is the timeline?
Thanks, Olivia. I think this is it's an excellent question. I think it's one that Canadians are eager to hear the answer to. What we heard clearly today is that there's work to be done at all levels of government, and given that there were 400 participants with many views, a clear timeline was set for a January reconvening with a clear action plan. In the meantime, I think there is a number of elements we need to exercise within our own jurisdiction within the federal government, and its role to respond to the reports that are already there and in black and white, what is expected of us. What we heard clearly from Indigenous leadership is nothing about us without us, and we have to respect that. So when we talk about the full spectrum of introducing distinctions-based health legislation, we have to have a consultation that is robust, and not pro forma. We've been criticized heavily in the past for that. And I think better legislation obviously comes once we've consulted and discussed in depth about the suite of reforms that need to be made. So what we are talking about is a suite of measures that need to be implemented, some soon, some later. What was clearly the case today is there is some stuff that can be done immediately. People can be held accountable. Better sensitivity and training can be done. I did have the occasion to speak to Minister Lafreniere right after our meeting today, who was on the call, and despite our differences, he wants to take some action, and I will hold him to that, and he will hold me to that. It is no surprise, and I think it's very important to remind you what Minister Hajdu and Minister Bennett said, is that there's a lot more carrot here than stick. It doesn't mean that option is precluded, but the reality is health as a jurisdiction that is jealously guarded by provinces. We need their help to reform it. We cannot reform the licensing bodies. We do not have the power. The Supreme Court has said it clearly in black and white. We need their help. And we hold them in good faith. We know that they will do it because it's about our identity as Canadians, but also about Indigenous peoples, with respect to which we still have a lot to learn and a lot of gaps to close. But we started by starting. There is a pathway forward to a January meeting. There are measures perhaps that need to be taken in more immediate fashion. But again, I think this is something that all Canadians are waiting for answers for, and we're eager to provide them.
You do have an option, though, with health transfer dollars to influence what the provinces and territories do. So I'm wondering if you can be very clear on whether this is on the table, that you could put a condition on these health transfer dollars to make sure that the provinces and territories address racism in the health system.
I think they're already eager to address racism in the health system. I don't think you'll find a single provincial minister that will say the contrary. What you're saying implicitly is that we would hold back should they not do so. And in the middle of a pandemic, I think it'd be careless to suggest that. What we need to do is ensure that when federal money is invested according to its constitutional power, it is done in a fashion that reflects our values and our moral and legal duty to serve Indigenous peoples and to ensure that they have first-class health care in the best country in the world.
I think Dr. Lisa Richardson's 10 wise practices in terms of the calls to action in the TRC have been very important in transforming certain institutions. I think today's meeting hopefully reminds all institutions that there was transformative action expected of them and that they need to be putting in place the things that Dr. Richardson and others have called for, the real prevention education piece, the real data and surveillance piece, and the ability to document bad behavior or these incidents, but also the accountability and consequences for what happens in terms of changing behavior and changing attitudes. So I think that it is about, as Dr. McCoke has said, it's about us going forward together and each of us doing our part. But I think today was very important that to really reconfirm that all of us are in this together and that we want to move forward and do what we can with the abilities we have in all orders of government.
And if I could, I'll just add that I also don't think that any of the partners on the call today would want to see a degradation of actually health services. Sorry, there's an echo. But I think, ultimately that's why I think that investment in trying to have systemic change at the front end is why it's going to ultimately end up in long-lasting change that is going to transform systems. I mean, punishments only go so far. I think we all know that from our own personal experiences, maybe if you've been a parent. But it's actually the other piece that's really, really important, which is, first of all, agreeing that the status quo is not okay, and then coming up with frameworks for all of these organizations that get to the crux with Indigenous people, by the way, at the table, saying, how does this systemic change actually occur? And how do we maintain it more than that? Because we've heard today many examples of cultural training which I think one of our speakers very aptly defined as cultural tourism. And that's not good enough. It's not good enough to have a basic sort of superficial understanding of Indigenous culture without a deep commitment to implementing in systems that you're responsible for a change in practice that makes people feel welcome and safe, regardless of whether they're working there or they're receiving those services.
Et juste en français, s'il vous plaît, puis ça va être la dernière question.
Je vais essayer de traduire ce que j'avais dit en anglais. La réalité, c'est qu'on a des leviers limités en matière de santé au niveau fédéral. Responsabilité envers et de servir les peuples autochtones, certes, mais c'est clair que dans le domaine de la santé, en matière de services médicaux, c'est une juridiction qui est jalousement gardée par les provinces. Ceci étant dit, nulle question de retenir de l'argent, surtout durant une pandémie, mais d'autant plus parce qu'on a besoin des provinces, de leur coopération. Je ne pense pas que vous trouveriez un ministre au niveau provincial, territorial, qui n'est pas contre le racisme, qui ne veut pas enrayer ce fléau qui résulte dans plus de morts, plus de gens qui sont mal servis, plus d'Autochtones qui sont mal servis par le système de santé au Canada. La coopération est de mise, évidemment, puisque la juridiction claire et nette sur les ordres professionnels réside avec les provinces. C'est écrit noir sur blanc dans les arrêts constitutionnels de la Cour suprême. Donc, prenons pour acquis la bonne foi et la bonne volonté de toutes les provinces. On a du travail à faire. Et ce qu'on a entendu aujourd'hui, c'est que ce n'est pas dans ce point de presse que le racisme systémique, un fléau qui tue des Autochtones et qui continuera à laisser tomber les Autochtones sera réglé aujourd'hui ou du jour au lendemain. On a un échéancier qui vise un plan d'action et un retour en janvier. Espérons en personne, mais je pense plus sur Zoom virtuellement, étant donné la pandémie, pour avoir des pistes de solutions pour enrayer le racisme systémique qui s'attaque à notre système de santé. J'ai pu parler à Yann Lafrenière avant le point de presse, après notre discussion. Il était sur l'appel aujourd'hui. Il a entendu tous les témoignages. Impossible de ne pas être ému. Évidemment, après ce genre de témoignages, mais c'est clair qu'il y a du travail à faire. Il a dit qu'il était un gars de l'action. On ne s'entend pas sur la définition de racisme systémique. On ne restera pas, on n'est pas sur la même longueur d'onde à ce niveau-là, mais il m'a donné sa parole d'honneur qu'il allait procéder à l'action pour s'attaquer au racisme à l'intérieur du système de santé, et je le crois.
Est-ce que je peux poser une autre question?
Une question de suivi, oui. Allez-y.
Ça fait, je vous ai entendu les ministres dire ça avance pas. Cet enjeu-là, ça fait 5 ans que vous êtes au pouvoir. Est-ce que vous avez l'impression que vous auriez pu agir différemment pour accélérer les avancées dans ce dossier-là?
Ben, écoutez, c'est clair que, et c'est difficile d'étaler tous les investissements qui ont été faits en matière de santé spécifiquement dans les communautés autochtones. C'est toujours un gouffre qui existe, structurel. Il y a eu des milliards d'investis. Il y a des hôpitaux qui se sont bâtis. Il y a des services accrus. C'est clair et les indices de développement socio-économique existent au plan des Nations unies. Il y a un rapport qui vient de sortir qui montre ce rétrécissement. Il y a encore un écart d'une quarantaine de positions entre les communautés autochtones et non autochtones au Canada, inacceptable, mais ce sont des indices qui, en grande partie, sont sous-tendus par des phénomènes en matière de santé et de sous-investissement en santé. Il y a du travail à faire. Le principe de Joyce qui est avancé en étant qui reflète l'équivalence santé du principe de Jordan pour s'assurer que les peuples autochtones aient les soins de première classe auxquels ils ont droit, mais ça prend non seulement les investissements que l'on fait, ce droit auquel je crois profondément, auquel tous les Canadiens devraient croire profondément, mais aussi la contribution des provinces, la réforme du travail qui doit se faire dans les associations professionnelles de déontologie pour qu'on s'assure qu'il y ait du suivi en cas de racisme systémique. Et dans la formation aussi, on a eu les témoignages d'étudiants en médecine aujourd'hui qui subissent le même genre de racisme systémique ou autre que dans les années 80 dans leur formation, des médecins autochtones qui ont été formés dans les années 80. Alors ça doit cesser incessamment. Et il y a du travail qui réside dans le secteur privé, notamment les institutions professionnelles, les corps de profession, les juridictions provinciales. Et donc, on a besoin de leur complicité pour s'assurer que ça cesse.
Merci. Ceci met fin à la conférence de presse. Thanks. This ends today's press conference.